We just wanted to ask you a few questions. So firstly, why you're here at the World Health Organization today?
Well, I'm here because, as you know, I have devoted my life to addressing climate change in a timely fashion. And we have progressed some, but it's very clear from the latest scientific report that has just appeared 2 weeks ago that the urgency is on our doorstep. We can lose absolutely no more time. And one of the very, very urgent things that is totally related to climate change is air pollution. And we have to attack both of these with one and the same instruments and with one and the same arguments, because local pollution is the same as global pollution, and we have to understand that they are one and the same. They come from largely from the same sources, and we have to be able to eliminate from the energy grid those sources that are polluting the air that we breathe and the atmosphere upon which we depend.
Okay, and what's interesting is that we've just taken the reading of the air pollution from your hometown in San Jose in Costa Rica, which has come up relatively healthy at 10.1. What would you say about the levels compared to somewhere like Delhi, which today, I think the reading was something like 160 or 70. So, you know, that kind of disparity in the levels of air pollution in cities across the world.
Yes. Well, I would say, you know, I think I'm actually very lucky that the reading in San Jose, Costa Rica today was as clean as it was. It is not always that clean. So I wouldn't want to cast the myth of the saintly city of San Jose, because clearly our transportation there is just as sturdy as anyone else. However, even in its worst days, San Jose, Costa Rica just doesn't have the pollution of a city like Delhi, because of the number of residents there, but also because of the quality of transport, and also because of the quality of energy being generated. Costa Rica doesn't burn any coal. Costa Rica uses, obviously, some fossil fuels for transport, but we don't burn any coal. So in particular, in those cities that still have coal-burning plants, that is where you see the absolute worst concentrations of local pollutants, and those are the worst sources of climate pollution, of CO2 emissions going into the atmosphere. And you know, it is so unfair, because those are generally the people who are least responsible for having caused climate change. So there is a huge unfairness here, that people who are not responsible for having caused climate change are, however, the major people who are impacted through their lungs of air pollution.
So on that basis, just a final question really is, you know, what are your hopes for the outcomes of this conference, given that, you know, you're talking about the people at the very sort of bottom layers of society are probably the worst affected, and we have their leaders here, representatives from different countries all over the world, trying to come up with some solutions. So I just wonder what your hopes were for the outcomes.
So I have two hopes actually for this conference, in the context of raising awareness of the overlap of these two issues, right? Climate change and air pollution. Frankly, one and the same. One and the same source, and one and the same in the solutions. Very interesting. But I have two hopes. The first is that we can contribute to public outrage that in the year 2018, we are still putting up with this amount of air pollution and causing as many deaths and sicknesses as we are. So public outrage, number one, no more tolerance. And secondly, that we can collectively develop the vision of the kinds of cities that we do want, of clean cities that are actually very livable cities, that are healthy cities, that are cities where our population wants to go. Not cities where actually people are leaving the cities because of the pollution, but rather cities that attract healthy living citizens there.
That's a wonderful message to send to the WHO. Thank you very much.
Thank you.